So Amazon has just made a huge move into healthcare. They're rolling out a new technology that's meant to cure one of the biggest headaches in medicine. So what's the prescription for fixing it? Let's get into it.
Yep, you heard that right. The same company that delivers your packages and powers, a huge chunk of the internet is now offering an AI platform. It's designed to be a doctor's own personal digital assistant, and it's called Amazon Connect Health. Okay, so before we get any further, when we say AI agent, what are we actually talking about? This isn't some sci-fi robot wheeling down the hospital hallway. Nope. Think of it more like a super-powered digital sidekick. It's this really sophisticated software that can understand complex stuff and just handle all that tedious background work for doctors and nurses automatically. So the big question is, why healthcare? Of all the industries out there, why this one? And why now? Well, the answer really boils down to a massive, multi-trillion-dollar problem that affects pretty much every single one of us: administrative overload. And to really wrap your head around this, you have to appreciate the sheer scale of the market. The US healthcare industry is a $5 trillion beast. And look, when you're playing with numbers that big, even the tiniest little inefficiencies, they just explode into monumental costs and a ton of frustration for everybody. And this is where that frustration really hits home. We're talking about all the endless, repetitive stuff: scheduling appointments, verifying patient details over and over, reviewing old medical histories, writing up clinical notes, and then the really fun part, trying to figure out the right billing codes. This is the administrative grind that leads to so much burnout, and it is exactly what Amazon's new AI is designed to attack. Now, here's something that is absolutely crucial. The service is HIPAA eligible, and trust me, that is not just some tech buzzword. It's everything. It means the platform is built from the ground up to handle our sensitive patient info securely, all in line with really strict federal privacy laws. Honestly, without this, a product like this is a complete non-starter in the US healthcare system. So this new AI agent might feel like it just popped up out of nowhere, right? But it's actually just the latest chapter in a long, very deliberate story. This is all part of Amazon's bigger healthcare playbook. Let's just trace the path on this timeline because it tells a really clear story. Things started heating up way back in 2018. First, they launched an AI for medical data. Then, bam, they bought the online pharmacy PillPack for about $1 billion. A few years later, they launched HealthLake to get all that data organized. And then came the real bombshell in 2022, buying the primary care company One Medical for nearly $4 billion. See the pattern? Each step was a deliberate building block, acquiring assets, data, and expertise, and it was all leading right here. Of course, an opportunity this massive doesn't exactly go unnoticed. Amazon is jumping into a field that's getting more and more crowded. A full-blown healthcare AI race? Oh yeah, it's officially on. And we're talking about the heavy hitters here. You've got OpenAI, the creators of ChatGPT, and you've got Anthropic, the company behind Claude. Both of them have recently rolled out their own products aimed squarely at the healthcare space. And this table breaks down the competition really nicely. You can see the key differences right away. OpenAI's product is aimed at us, the consumers, and it's not HIPAA compliant, so it's more for general questions. Anthropic is kind of targeting both professionals and consumers with a compliant product. But look at Amazon Web Services. They are laser-focused on healthcare professionals with a fully HIPAA-eligible platform. They aren't trying to be everything to everyone. They are building a specific tool for the clinic. Okay, so we've covered the why, the strategy, and the competition, so let's get down to the specifics. What does this new platform actually do today? Amazon's doing this in phases. Available right now are tools for patient verification and something called ambient documentation. And this is a big one. It's basically an AI that listens to a doctor-patient conversation and automatically generates the clinical notes. Super cool. Then in the coming soon category, you've got appointment scheduling and patient insights. And even later, we'll see more complex stuff like medical coding. It's a classic tech rollout, right? Start with the core features, then build from there. So what's the price tag? We're looking at $99, and that's per user, per month. So that's for each doctor or nurse or administrator who's on the system. But here's the crucial context for that price. That $99 covers up to 600 patient encounters a month. An encounter is basically any significant interaction, like a visit or a call.
Now, Amazon says that your average primary care doctor has about 300 of those a month. So this pricing model is designed to more than cover the workload of a typical physician.
Which brings us right back to the final essential question. You have these trillion-dollar markets, billion-dollar acquisitions, and a race between the biggest tech companies on the planet, all aimed at solving this one problem. So, will AI, in the form of tools like Amazon Connect Health, finally be the prescription that cures the administrative burnout plaguing modern medicine? That is the big question we'll all be watching.